beginning of her pregnancy, Cassidy Lindmeyer couldn't find a doctor to prescribe her opioid addiction medication, and her supply dwindled.
I wasn't taking as much as I was supposed to because, just to be safe, and I'm glad I did because I wouldn't have been able to make it through if I would have been taking what I should have been taking.
She rationed what she had.
I mean, it helped me get through without withdrawing or anything, and I just had to stretch it out as much as possible.
It's really dangerous for pregnant women to stop their addiction medicine cold turkey. A few things could happen. It takes hours for withdrawal symptoms to set in. The cravings and the pain might get so intense that she uses again. If she's far along in her pregnancy, this could cause a miscarriage. Maybe the relapse exposes her baby to infection. Or she could die from an overdose. Cassidy got turned down by 3 doctors before she found this prenatal clinic at IU Health in Indianapolis.
Cassidy? I was really getting down low. I was really stressed out, and then they said they couldn't help me. But as soon as I got in here, they, got me something that day.
Now, at 37 weeks pregnant, she travels over an hour to get here. Dr. Tara Benjamin runs the clinic.
Well, when I first started doing this, I was looking for regular addiction providers that would provide treatment for pregnant women because I felt like I shouldn't have to do this because there are addiction providers out there. Well, when I started looking for it or searching or calling or asking at conferences, no one said that they would take care of pregnant women.
The pool of providers qualified and willing to treat pregnant women for addiction is pretty small. First, doctors need to take an 8-hour course in order to get a waiver that allows them to prescribe addiction medicine. But only a fraction of those doctors use the waiver. The majority of Dr. Benjamin's patients are on Medicaid. Few doctors accept Medicaid for addiction medicine. It's also hard to find doctors even willing to prescribe to pregnant patients. That's why the number of doctors these women can go to for treatment during pregnancy is so small.
So private insurance should cover their treatment, but if a woman is on Medicaid, then specialty services like addiction may not be covered.
Medication is only one part of good addiction treatment. Counseling increases a patient's chances of recovery. Dr. Benjamin says 90% of her patients have experienced some type of trauma in their lifetimes. Social stability is important too. Maybe her social network is hindering her recovery and she needs to move. Indiana Medicaid will cover her medication, but counseling and social support, often insurance isn't designed to reimburse doctors for these things. Dr. Benjamin says that's why a lot of them won't treat her patients.
Other concern of these providers is liability. They are afraid that they may do something to harm the pregnancy, so that scares them.
Cassidy says that's kind of what happened to her. Her original doctor prescribed her medication. The medication combined with therapy helped her control her cravings, keep a job, care for her daughter. But when she got pregnant, her doctor dropped her.
If I had my way, whatever doctors were taking care of them before would continue to take care of them. It's actually better for you to continue writing for this person once they get pregnant. Like, stopping it is the worst thing you could do.
Several years ago, the number of pregnant patients coming to Dr. Benjamin's clinic with opioid use disorder was small. But now over 50% of her patients need opioid addiction treatment.
Yeah, these are all things that I wasn't necessarily trained to do, but these are tools and skills that I'm learning so that we can provide the best care for these women.
Even though she's an OBGYN, she has dozens of pregnant patients that she's treating for opioid addiction. To help manage the load, she started support groups for women due around the same time.
So the motivation for the group was we see a number of patients, and we find that we're saying the same things in each appointment, and each appointment can take much longer than a normal OB appointment because there are so many more things that we have to discuss.
These women take a medication called Subutex to curb cravings and keep from overdosing. But it gets a lot of scrutiny because Subutex is also an opioid. So it's often misunderstood by family members who think it's just a substitute for heroin.
A lot of the reason why I don't tell a lot of my families is because they don't understand.
So the misconceptions, and actually I find that the misconceptions come from family members more so than the woman herself. Some of the misconceptions are you're still exposing your baby to something. In order to be considered sober, you have to be on absolutely nothing.
This isn't just, something that we've just decided to do. We're making the best decision for our children, really, ultimately.
Another obstacle, the Department of Child Services. A handful of these women have open cases, and if they fail their recovery, they could lose their parental rights when their baby is born.
Yeah, I have a current DCS case, so it's a pain. A pain, absolutely.
But some people feel like they've been involved with them so much that they don't even want to see them. So whatever you guys decide.
It's awful.
Dr. Benjamin suggests inviting a caseworker in to talk to the group.
We could also take it as an opportunity to teach them, because a lot of DCS workers don't know what Subutex is. They think that it's still something illicit, or they think that it's something you should be trying to hurry up and get off of. We could use it as an opportunity to educate them.
The Indiana foster care system is already overwhelmed by the opioid epidemic. Thousands of kids need homes because of it. Yet the Department of Child Services budget has decreased over the years as the number of children needing services has increased. They're doing more with less money. Once these women deliver, Dr. Benjamin will keep them for up to 12 weeks. Since she's an OBGYN, they'll need to find a new provider to continue their addiction treatment.
That's kind of the biggest barrier that we have, because that transition time is very important. It's the 4th trimester of pregnancy, the postpartum period. It's a period where they are very stressed out, they're very fatigued, they have a brand new baby, they're having hormonal changes in their body. They also have a risk of postpartum depression or other postpartum mood disorders, and all of these things are really high risks for relapse, which we really want to prevent, because in most cases these women have done very well during the pregnancy, and it's such a shame if they end up relapsing in the postpartum period just because they couldn't transition.
To see more videos from this series on the front lines of a drug crisis, follow us on Facebook. Side Effects Public Media is a reporting collaborative led by WFYI in Indianapolis. Our partnership includes KBIA in Columbia, Missouri, St. Louis Public Radio, Illinois Public Media, WOSU in Columbus, Ohio, and WNIN in Evansville, Indiana.